Welcome to my recording and video about the differences in between health in Nigeria and America, the United States of America. In the U.S., good health and well-being are supported by advanced health infrastructure with lots of money, access to a wide range of medical services, and a focus on prevention and treatment. However, disparities in healthcare access and affordability exist, that which they do. You've seen it recently with the bad things that have happened, you know. Um, with United Healthcare CEO in Nigeria, while health initiatives take aim to improve public health, challenges like limited access to quality healthcare and sufficient infrastructure and a high burden of infectious diseases remain. Efforts are being made to expand access to care, but resource constraints persist. This is very true. There's just not enough money for them. It's a summary that I put there myself, and it's just it's if they had more money and they weren't in such poverty, I feel like they'd be able to afford better things. And a corrupt government, such things like that. Let's take a look at ourselves, America. This is as of 2016. Maybe it was 2021, I believe. We are obese. Mississippi has a 40% state rate. 40% of the people that live there are obese. That is too many. 37%, I'm pretty sure it's more now, in all honesty. But at the time, 37%. That's too many. Inactivity, 22% of the people. That's about a quarter of people that just don't do anything. You know, that's not good. It's not good for society. It's not good for work ethic. It's not good for everybody. People need to work for each other to build each other up. And then diabetes, which we're not as high as other countries, but still, it should be lower with the amount of insulin that we have. Not saying that it cures it, but it negates it in ways. Now on to Nigeria. And yeah, as of 2016, 7%. Their issue is funding. And in activity, they have a 40%, 30 to 40. I saw something that said 47 or something maybe too. But yeah, lack of food. They just don't have enough for people to fuel themselves to even be active. It's a very, very big issue. You need the food to actually go do it, be an active person. No, with diabetes, it's a lot lower because not as many people are as big. Now, with America, COVID was a recent scare that we had, and this is the way that vaccines reduce. And in some other countries, they didn't have this. It was a 95% risk reduction. There was 9,245 infections among more than 95 million Americans recently, as of last year, probably last actually. They use like seatbelts, exactly. 45% reduction rate, risk of death. Vaccines do good things. Now, going through my mind chart, which is kind of long, but these are the different goals and things that are set and that relate to the different diabetes rates, inactivity rates, obesity rates, and my different conclusions. Nigeria, they, it's now around 25%. It's gone higher. Fast food consumption from brands like KFC and Domino's Pizza, our fast food consumption is way too much. Same with them. But Mississippi and Arkansas, yep, them people, they're big. 37% of adults are classified as obese in America. Absolutely. Now we go to inactivity, which I think is more of the issue of people not working out and actually going outside and getting physical activity, being too tired from the workday. That affects everybody from the 9 to 5. Influencers. People spend way too much time on their phones. That's a fact. Nigeria, inactivity. 30 to 40% of Nigerians engage in low levels of physical activity. Not as bad as America, but as I said, they do not have the resources probably to feed their people as they should be able to. Now on to diabetes. 10.5% of our population has diabetes, which is what I said last slide. And influencers again, poor diet. They're just people. There's a lot of outside influences like politics and different companies getting together, different monopolies, even in that sense, getting together and spending money to feed us poison, basically. And that's the part we're at. We need to fix it. With Nigeria, um, prevalence of diabetes is 6%. It's rising due to lifestyle changes and them getting more funding and resources that they need. It's naturally going to happen. Now, down to the goals. Different feeding programs. USDA SNAP program, the National Strategic Health Development Plan. That is huge. Absolutely huge. Programs like the CDC's Million Hearts Initiative, which all of these different programs, they do so many good things to make sure that people are actually getting fed in the right areas. And it's still a big issue. And it's not nearly enough to where it needs to be. But as long as the programs keep growing. So can the hunger population decrease? So, onto some solutions. Keeping people healthy in their minds and aware that these things are going on. Making sure that people work out. There's a lot of diseases that people get, and they can be prevented by, I think, staying healthy. And, they're very preventable things by making sure that your body stays healthy. Injuries when you're older, making sure that you stay age old, and just different things like that, living until you're 90 or 100. Everybody wants to live to that old. And then diabetes, you need to get people in shape. Can't be reborn, you know, um, or you can't be born with it. Type 2 diabetes is preventable. People just need to work out. It's that simple. Thank you for your time.